Thank you for staying with us. This is Good Morning Kenya, and right now we talk matters health, and we'll be looking at hypertension and diabetes. What do these two have in relation? How do they correlate? How do we get to know when you have either of these two? What are the causes? How can you be able to prevent that? All of those questions will be answered right here on the show. As I have with me Dr. Florence Kelly. Dr. Florence is a consultant physician and an endocrinologist. Welcome to the show.
Thank you.
It's a pleasure to have you on board today. May we first begin by just defining these two conditions. Let's begin with diabetes and then we go to hypertension.
So diabetes is a condition where the blood sugar is high. And what do we mean by a high blood sugar? Is a status or a situation whereby you go get a test. You can do it at home, you can do it at the clinic. The test can be done while you are being treated. It can be done anywhere, anytime. So it's a blood sugar of more than 7.8. To make it easy, is a blood sugar of more than 8 at any one point. Yes.
All right, and the hypertension?
Hypertension is when a condition when your blood pressure is increased. That is a blood pressure of more than 140/90. Usually you look at the two figures all the time. The blood pressure is read as two readings, not like the upper one, the lower one. They must go in sync. Sometimes one of the two entities, the upper one may be up, the lower one may be up. That is still hypertension. It just depends on the scenario and must be treated.
All right.
Yeah.
Okay, so for hypertension, it's blood pressure.
Yes.
And then for diabetes, it's all about your blood sugars.
Yes.
Well understood.
Yeah.
So now, how do these two correlate? And can one have one and not have the other, or do they always have to? If you have one, you definitely, is it a guarantee that if you have hypertension, then you have a higher chance of getting diabetes as well, and the other way around?
The two are correlated sometimes and not, because diabetes, there is a whole range of diabetes. You can have diabetes because you are overweight, you are of advanced age, and you meet certain criteria. You can have diabetes because you are the organ that produces the hormone that corrects blood sugar is not working properly, and that is another type of diabetes. So that's why I'm saying sometimes it correlates, may not correlate. You can have diabetes when you are pregnant. You can have diabetes because you are born of low weight. That is malnutrition when you are in your mother's stomach. Let me use stomach for the audience. In your mother's tummy, you can have diabetes. There are so many types of diabetes that we count from 1 to 5, and so it may or may not correlate. So if you have diabetes because you are overweight, you have something we call metabolic syndrome. The way you are metabolizing, the way you are breaking down the nutrients that you are taking is abnormal because you are taking them in excess. So there is a very high chance that your blood pressure, if it is not elevated at the moment, it will go up at one time. So you see, it may or may not correlate. Yes.
So it's not guaranteed that if you have one, then you have a higher chance of getting the other. They don't always correlate.
Yes.
They may correlate, yes, but they don't always correlate.
Yes.
There's a question I've had two ladies asking me, on matters blood pressure and pregnancy.
Yes.
And how do the two come about? You have a lady who's always been healthy, never had hypertension ever, and then now when she gets pregnant, she gets the hypertension. How does this happen? So
when one has someone growing in their stomach, that is in the mother's body, there are very many things that get adjusted because you are supporting another life or even more than one life. So what happens is that the body reacts to products that are being produced from the placenta, and then the blood pressure goes up, and that must be treated to prevent the mother and the baby from getting into worse conditions, you know, organ failure of the mother, and the baby dying or being born of low weight.
Yeah.
Yes.
Yeah. So when a mother gets hypertension during pregnancy, is this just a condition she has because of her pregnancy, and does this mean that after she gets to deliver her baby, then the hypertension is no longer there?
So usually it might be something that has been lacking. Usually we refer hypertension as a silent killer because it doesn't ache. You cannot say that my blood pressure is aching. It is there, but it doesn't have a symptom. Yeah. So in most cases, it's found when you go for treatment, even for headache, for a flu. Usually there is a red herring, you know. There is something that made you to have the blood pressure checked. You went for a medical camp, you are in a place whereby you checked your blood pressure. Then you realize what? It is more than 140, 90. So when a mother conceives, it means that there is this condition that has triggered the blood pressure to go up. But it may be also before she got pregnant or conceived the baby, she might have been having high blood pressure. Those are two different conditions. If the blood pressure was due to the pregnancy, then it will resolve over time. And it's not immediately after the baby is born. Sometimes even just during the puerperium, the time when the baby has been born, when we have the infant, when we refer the baby as an infant, the blood pressure can actually be up. It can even rise up because you are in the puerperium period, when you have the infant. Then it will abate, it will go down over time. So it is advised, if you are found to have any of those conditions, either diabetes or hypertension, get followed for 1 year so that the doctor discharges you from the condition. And we know that truly so-and-so was having this condition in pregnancy, but it resolved. And sometimes it may not resolve. The diabetes may not resolve. The hypertension may not resolve. So it's best to be followed for a time, 1 year, so that you can be discharged from the condition.
All right. Can we talk about the early signs of both conditions?
Yes.
Can I be able to tell that I may be having this or that? Because you mentioned with hypertension, you might not know until you go for a checkup.
Yes.
So what are some early signs for diabetes and for hypertension? So
the earliest and cardinal sign that can make us think that you have diabetes is when you are of excess weight. That is for type 2 diabetes. Okay? And for type 2 diabetes, you have to qualify. There are many other things that we'll check, and then we ascertain that you are having type 2 diabetes. So when you are overweight, your blood sugar is more than 7.8. When you take your meals, if the blood sugar lacks above 8, 10, 14 over several days, or when we give you a glucose challenge, whereby we give you a load of glucose and we monitor you at intervals of 30 minutes, 1 hour, 2 hours, and we find that your blood sugar is persistently more than 8, then you have diabetes, and that is likely to be type 2 diabetes. What are the symptoms of type 2 diabetes? You will be taking excess of water. That is when it is very, very bad. You will be passing a lot of urine and you lose weight. Yeah, that means that your metabolism is wrong. For the other types of diabetes, there is usually something that will precipitate or trigger. So that is another scenario altogether. For blood pressure, the cardinal sign for blood pressure is just a headache. If you are having the other symptoms, such as passing inadequate amount of urine, maybe your heartbeat, you feel like your heartbeat is too quick, you're getting too tired, it means we are beginning to have complications. But the earliest sign is a headache. A headache. Yeah. How can you tell if a baby may have diabetes? You know, for the symptoms that you've mentioned, it takes one to really, you realize that, okay, I think I'm taking excess water. Okay, my head is aching. But for a child who can't tell you, how do you get to know? So at least nature is kind to us in a way. If you have type 2 diabetes, you are likely to be of advanced age. more than 45 years. And that's why we advise that when you get to 45 years, 40s, have a check. It can be simple. Just get an annual blood sugar, or every 6 months check, and if there's a family history. If it is a baby, then the baby cannot be overweight. The baby was born with the right weight, unless the mother is not doing what they are being told at the clinic. Feed your baby up to this level, or you are not giving extra food, the baby will not have type 2 diabetes. But you can have a familial form of type 2 diabetes, which doesn't respond to insulin in this case. And that's a whole subject. It is many types of the subsets are so many for that kind of familial diabetes, whereby the parents will note a symptom. And the earliest symptom that they usually note is that the baby's diapers are excessively wet. I'm changing them too frequently. Yeah, so that's why I say nature is kind, because you kind of know if it is this age, it's likely to be this side. If it is an older person, it's likely to be type 2. Even a newborn can be born with diabetes. Yeah, especially the familial type of diabetes. And the mother will just tell you, this child keeps on feeding and is passing too much urine. Yes, or is not gaining weight.
All right.
Yeah.
That was for diabetes. For hypertension, can you tell?
For hypertension, for the baby is a bit is difficult. But an adult, you can tell, because you know, whenever we go to be treated, we'll have our what we call the vitals, you know, the most necessary measurements to be assessed. Even if you don't get to complete your treatment, we'll be knowing your blood pressure is this, and our healthcare provider will caution you and tell you, you can't go home. You need to check this. Even if you don't still accept, you'll be knowing at the back of your mind that my blood pressure was high. For the babies, we do check the vitals. If the blood pressure is beyond certain limits, it will be treated. But in most cases, you will not find it normally that the newborn's blood pressure is being taken. Nature is kind. A child will not just have hypertension unless there is a background problem like a kidney infection. And once we note, you know, you pick the kidney infection, you be very particular with knowing, is the blood pressure of this baby, this child, this teenager normal? Yes.
What are the risk factors for hypertension? I think you've touched a bit on diabetes.
Yes.
What of hypertension? So
hypertension has got modifiable and non-modifiable risk factors. So it has been established that being of this race, unfortunately black race, being an African, is a risk factor. Advancing age and a family history, those ones you can't modify. You are born in that family, so the genetics and the risk factors in that family. The modifiable risk factors are lifestyle mainly. Are you having excess weight? Are you living a sedentary lifestyle, whereby you never move, you just swing around your chair and walk to the parking lot and off you go home? You don't really have activity. Okay, sedentary lifestyle. It's about a lifestyle. So you find that some certain people, when you adjust the lifestyle, take less of nutrients, exercise, lose 5% of your weight, your blood pressure will go away. That is if you don't have the other risk factors. And even if you have the other risk factors of being born black, family history, still the lifestyle change is a mandatory intervention. It must happen because it is an established way of managing all the diseases beyond diabetes and hypertension. Yes.
So diabetes and hypertension are not chronic, or are they chronic?
They are chronic.
Okay.
They are chronic.
So you'll need to be on medication for the rest of your life?
Yes, depending on the type of diabetes that you have and whether the adjustment has happened. It depends on the type of diabetes. If you have type 1, which is because the insulin is not, the pancreas is not producing enough of the hormone, then you have to be given the hormone over time. Yes.
Okay.
Yeah.
How common is diabetes and how common is hypertension, specifically in the country? Maybe if you try compare it to, say, 20, 30 years ago, how common is it now?
It is common. It is common nowadays.
More common than back then?
Yes, it's common, especially type 2 diabetes. It's very common. In fact, you can have a random blood sugar taken and you find that I have diabetes, I have hypertension because of the lifestyle. Remember I said lifestyle is an intervention for all the diseases. So you can find that because of the lifestyle we lead. Remember our parents, our foreparents, they walked like from Machakos to Nairobi. They went far, they went gathering and hunting. That was an intervention by itself. Even the foods we take, they trigger. The environment has got triggers, so the sedentary lifestyle and certain foods can trigger if they are taken in excess. So you can prevent diabetes from taking the adjustment, and if you don't do it, it will become chronic. Yeah.
So it's more common now mainly because of the lifestyle that
yes,
we are.
Type 2 diabetes is very common, especially among adults. Yes.
So you need to move more.
Yes.
Move as much as we
Just
can.
keep moving. You know those things that I think there are some certain adverts of certain products, I forget which ones, which say keep moving. If you move, it's better. It's when you rest for too long, you may think that you are resting your body, but you're bringing it down. Even the joints suffer. They complain that we were created to move. We are not moving. Yeah.
So when you look at prevention,
yes,
the first way of prevention or of preventing these conditions is just by you ensuring that you are moving your body, like exercise and all of that. Like just watch your lifestyle. Is that one of the ways of preventing? Yes,
but one of the ways of preventing hypertension, at least. One of the ways of preventing type 2 diabetes, because it emanates from altered metabolism, the way you break down the nutrients, and whether when you take these nutrients, are you making use of the energy that is being produced? Are you exercising? Yeah.
And also what you're eating.
Yes.
Yeah. Okay. At what age should we now start paying attention to our blood pressure, our blood sugar? At what age should we start paying attention to that, and how often should I be going to check?
It is very prudent for one to do annual checks, especially when they get to the 40s.
Okay.
At 45, you should have started checking your blood sugar, your blood pressure. Have a simple annual check. And if you have a family history of a chronic disease, let me just diverge a bit from hypertension and diabetes. Make sure you check it, because it means that there is a genetic alteration and that puts you at risk. So go and check, have that specific test so that whatever it is can be managed at the early stages. So at 45, blood sugar, blood pressure checks. Yeah, for type 2 diabetes. For the other types of diabetes, it will be found because there will be a symptom. For the women, because the two conditions can occur in pregnancy, hypertension and diabetes, attend the antenatal clinics. Right now, we are advocating for assessment even before you conceive, because when you go into pregnancy, when you are healthy, it means that the outcome will be perfect, because we'll have established what an underlying problem could be, what you may be having as an underlying problem even before you conceive. And if you don't get assessed before you conceive, because some of these things are natural. Now I'm talking about a robotic human being, but in a natural setup whereby someone woke up, drove, had an accident, another one was bitten by a snake, you know, that kind of lifestyle. There was a spider that scared a woman. In that setup, a natural setup, is that once you realize I am truly pregnant, go for your first assessment. Yeah.
go get things checked.
Yes.
Yeah. And I think that's one thing that maybe we don't have a culture of.
Yes.
I don't know if it's right for me to use that word culture in this, because I feel like we only usually just go to hospital when we are unwell.
Yeah.
We don't have that culture of, let me go for my annual checkups. Rarely do we do that. There are people who are committed to doing that, but I think the majority of us do not do that. You know, with going with the saying, what you don't know won't hurt you. How hurtful is that to our bodies?
I know our culture usually, and most a human being, you don't want to be told bad news.
Yeah.
So you refrain from knowing the bad news. But the thing that we need to remind ourselves is this: when it comes to medical conditions, when they are found at the earliest, at the beginning, it is very easy to manage them, okay? The medications or the intervention to be used will be very minimum. So for example, if it is high blood pressure, you find that you will need minimal dosages for management of the blood pressure, and even for the diabetes, even if you use insulin.
Yeah.
You know, the thing, we have to learn that when the intervention is brought in early, it is safer. If it is type 2 diabetes, we catch it early, we get aggressive, we hit it hard at the beginning, and then we taper, we remove what needs to be removed because we improve. Even for type 1 diabetes, we are even getting to a point where we are precise. You know, now it's about precision. You're not just going to the forest and say that I'm going to look for oranges or apples. A forest is in Ukambani, and you say you're going to look for apples, you won't find. It is too hot to support an apple. Yeah. So likewise for type 1 diabetes, whereby we want this person to live a normal but adjusted life. What does that mean? We want to weigh the carbohydrates that they are taking against the insulin that we are giving. Okay? In our setup, because maybe we are resource limited. But we are also advocating for something we call a continuous glucose monitor. Why? The patient goes home. It's not with the doctor. They will be managing themselves. So we want to check that. We want to have a gadget that communicates with the doctor, with the mother, father, and with the patient, and they know that at 9 p.m. my blood sugar is this, 9:15, 9:30. That's continuous, and eventually we will get to a pump whereby we give insulin. You and me have got insulin that is working on what we took in the morning, okay? The right amount of insulin the body is giving, because we are not type 1. But for type 1, we want to give them a pump. And maybe in the future, we also want to give them a transplant, whereby now it is generated from the body.
Okay.
Yeah.
Okay. What happens when diabetes and hypertension are poorly controlled over time, or you don't get checked over time?
Okay, that is a very important question. Now, when those two diseases are not controlled or they are ignored, they take a natural history. What is a natural history? Both of them, and especially diabetes, because it is metabolic type 2 diabetes, okay? And whatever type of diabetes, when the sugar is sustained high in someone, they will begin having organ failure. And there are many organs that can fail. I will start from the head to the toe. So this person is at risk of a stroke, dementia, Parkinson, movement disorders, whereby you just keep on shaking as you age. And then you can lose your eyesight. You can bleed into the eye. You can have a heart attack. You can have kidney failure. And for the men, they will have erectile dysfunction. And it becomes a very real problem, because the wife or the sex partners, something that we never discuss, they will be complaining. Okay? For hypertension, it's a similar pattern. but maybe a rapid pattern because the blood pressure is high and the organs that are vital are not getting the supply in a normal fashion. So you can have a stroke, you can get a heart attack again, and kidney failure. For diabetes, you can also end up having prolonged wounds whereby the wound takes more than a year, 2 years to heal. You can also have your legs and limbs cut off because the blood supply gets compromised due to a sustained high blood sugar.
Oh. So it can be really a lot if you don't get it controlled, you know, early, or if you don't get it checked as it should be.
Yes, and then for the women, when they have diabetes in pregnancy, the baby can be born abnormal, too big. During delivery, you are likely to have complications whereby the shoulders will have abnormalities. There will be, because of the maneuvering, as the baby is delivered, the baby can be born with high blood sugars and is not thriving after delivery. They also face a risk of being diabetic when they grow old. The baby can also die. Actually, that's the commonest, because the baby will, I keep on having stillbirths. My baby has died in my tummy, those kind of complications. And then also the mother, when the blood sugar is high, all the complications that can occur in a diabetes patient can occur in them, the ones I've just said. If the blood pressure is high, that one moves very rapidly because you hear, I'm sure you have heard of these terms of eclampsia, preeclampsia, whereby your blood pressure is high and your body starts reacting. Your liver is failing, you can have a stroke, you can have kidney failure, and I've seen people who have developed kidney failure because their blood pressure was poorly managed during pregnancy. That's a very expensive venture. Yeah, lifetime condition just because we didn't give you a pill. Yeah.
Wow, okay. So for someone who has these conditions, or either of the conditions, of course there's hope. You know, when you mention all that, it can be really scary, but of course there's hope. So let's get into the options available when it comes to treatment. Yeah.
So we are at a very good time for all the diseases, actually, because a lot has been discovered. Let me start with blood pressure. So for management of blood pressure, as I said earlier, when we start treating early, we advise you on lifestyle adjustment, move more, take less nutrients. If you take more nutrients, make sure that you make use of them. You can run, you can exercise, as directed by your doctor, what is suitable for you. And then there are many drugs that we use to manage blood pressure. We cannot even exhaust, we can't. There is too many options that are good, and the advantage about these medications is that the major regulatory bodies have said that whenever a new medicine is being developed for hypertension, diabetes, it must have another advantage. What is the other advantage? It should improve the heart and circulatory system. So the medications we have are good, they're enough, and they're available in our country for management of blood pressure. Now it gets more exciting when it comes to management of type 2 diabetes. Type 1 diabetes, I've told you, we are now advancing towards even getting insulin pumps. We have patients in the country who have got an insulin pump, and you are just comfortable. You can conduct an interview with me, and you have your pump, or you have your glucose, continuous glucose monitor, or you've been taught by your doctor how to check your blood sugar. You check it before, you check it after your meals, and you're able to correct and adjust the insulin accordingly. So it's a very good time right now for type 1 diabetes. For type 2 diabetes, that is even better, although the drugs now are being used for other things. So for type 2 diabetes, The regulatory bodies also say that for any new medication, it must have another advantage, especially weight loss, heart, and all those. So that's why we have the drugs that are being used for weight loss. Those medications, let me emphasize and look at the audience. Those
Please
medications are supposed to be used for management of type 2 diabetes. But if you are overweight and you are at risk of developing the metabolic diseases, that is the type 2 diabetes and hypertension, then you are allowed to use them so that we mitigate. But the best treatment for weight is lifestyle adjustment. So for type 2 diabetes, we also have very many good types of drugs that will amend the status of high blood sugar, and you can live longer. And the complications I talked about, your doctor should be able to tell you that. I would want you, when you are diagnosed, actually immediately you are diagnosed for type 2 diabetes, have your eyes checked, let's check your kidneys, and let's check your heart. What is the status of your heart? And in your lifetime or subsequently, at least when you have diabetes for so long, type 2 diabetes, then you should have an echo. An echo is just an ultrasound of the heart. Make sure that it's not enlarging, it's not getting out of the normal. So the options are very, very many and good and doable and available in the country. Yes.
So as much as, you stated at the beginning that we have more cases of diabetes and hypertension now compared to, say, 30 years ago, you also agree to the fact that managing these conditions is way easier now due to the advancement in technology.
Yes. And just the precision that I talked about, because right now we know that if you lose 5% of your baseline weight, you are 90 kilos, and then you go off with 5%, I know that your blood sugar is going to improve, the blood pressure is also going to improve. And if you lose 10%, I also know that there will be further improvement and reduction of medication. Some people may go off medication, but you must maintain. If you lost 10%, maintain the 10% weight loss. At 25% weight loss, you revert back to normal. It is a long journey of losing 25% of the weight. You can achieve it with the drugs that are being used for weight loss, and you can also lose 25% of weight by a surgical intervention. Now, those two interventions, we usually leave them for the last, those are the last options because they are not cheap. Surgery is not cheap. The medications for weight loss are not cheap. And one aspect that is usually forgotten, what led you to be of excess weight? The psychosocial factor, the psychology. What made you to partake of excess nutrients? Why don't you move? Do you have arthritis? Do you work in a place whereby you leave at night and come very early? Do you work in a place which does not support exercise during the day or some part of the day? All those factors must be considered. Are you going to maintain the weight, the 25% weight loss that will occur after the surgical intervention? It must be factored in, and you must have the psychologist working with you, dietitian working with you, so that you maintain that. Yes.
What is the role of sleep when it comes to blood pressure and blood sugar, diabetes? Is that
very important question? Sleep is part of lifestyle. If you are not, and I'm not talking about the employers who cause people to work or you work at night. If you are working at night, you must find a way of achieving 7 hours, at least 7 hours of sleep in 24 hours.
At least 7. 7
hours of sleep. And it's not in the light or with the TV on, or you are scrolling on your mobile. There is a master gland, and the brain, they don't like when there is a clock in the brain that doesn't work very well with the light. So if you are going to sleep in the day, make sure that it's dark, so that the hormones that are produced in the night will be produced. I've complicated thing, but it contributes to those two diseases.
I feel like it's a whole other conversation on that, because now I feel like I have so many questions when it comes to that. There's particular, like, the room needs to be dark.
Yeah, it needs to be dark because there is a hormone that we produce at midnight called cortisol. So cortisol was meant to be produced when it's dark, okay?
Yeah.
So it will go very high in the night, and cortisol is very important because it controls metabolism. It also protects us from infections.
So for people who work during the night and get to maybe rest during the day, there's something you're missing simply because there's light. I don't know if I'm asking the proper question, but this is new news to me. So there's something I'm missing when I'm sleeping during the day and not at night, because now clearly you're not sleeping in a dark place because it's during the day. And I'm sure for most people there's still light that is coming in. In fact, you've even drawn your windows, your curtains.
Yeah, it's true. So when you don't sleep, when you lack sleep, okay, what are the right words? If you don't sleep at night, if you are working, you miss the biological clock is altered. Yeah, because you're not the cortisol is not being produced. It may be produced in excess, which is not also nice. It controls metabolism. When it is in excess, you gain a lot of weight, which will lead you to have diabetes and hypertension. There is also melatonin, which is poorly understood but is very important. It gives us sleep and calmness, such that when you wake up in the morning, you're not jittery over very small things. That is just one part of it. So it's produced also in the night, and it's also part of controlling weight. It has been established that when you have right amounts of melatonin being produced, it controls the brain functionality. You are stable, and even as you age, you are at risk of lesser diseases of the neuron, that is diseases of the brain.
All right. So for all of us or everyone who's quite busy, and maybe they happen to just get 4 hours of sleep, 5 hours of sleep, even if it's at night, you would advise that you try and get at least 7, because there's something it's doing for your body.
Yes. Yeah. Okay. 7 hours. And also for the people who sleep too much, you will also get diabetes and hypertension. You are at risk. In 79 hours.
Wow.
Is okay.
Okay. That's new news to me, and I'm sure it is for many people. So thank you for sharing that. As we almost come to a close of our conversation, maybe what would you say is a mistake that most patients, and these are diabetes and hypertension patients, what are some of the common mistakes that maybe you may point out that they make when it comes to managing these two conditions?
So the mistake number one is denial, which also I understand, and that's why we have the psychologists, the need for a psychologist to just stand with our patients and explain to them, in as much as this has been found, hypertension or diabetes, it doesn't sign you to death. You just need to take the right action. So over time, or immediately, or with the support of the healthcare providers, accept the condition, because it becomes much easier to manage. Now, once you accept and you follow what your intervention is saying, are you supposed to be taking your medications at what time? Okay, take them, because if you are faithful, they will be adjusted downwards depending on what is happening, or upwards, just to make to get optimal control. So adherence, adhere to treatment, and follow up with your clinics. If there is an extra examination to be conducted, accept, because I believe that the providers will not be taking advantage financially, and there is room for postponement, but not to another year. Let's say I have sent you as a diabetes patient to have your eyes checked. I will give you a timeline. Within 6 weeks, or before the next appointment of 1 month, 6 weeks, 2 months, just put an effort and have your eyes checked. And for the audience's information, we have good centers that are affordable and you can plan for eye checkup. Like we have CTI, we have Kenyatta Hospital, we have Kikuyu Hospital, we have Lions, we have places where your eyes can be checked. And I'm very passionate about eyes being checked, because I can't imagine you are born seeing and then you are dying when you are not seeing. How now, surely? Yeah. Yes.
All right. If there's one thing you would love our viewers to take from our conversation, what would it be?
I would want people, when they get to their 45th year, honor yourself. Celebrate that birthday by going for a medical checkup. And whatever is found, have it managed. If your family has a certain history, at the earliest, go and have it checked, because if it is even a cancer, we will just remove it where it is, you know, at that point. We'll just get rid of it. Yeah.
Yeah.
And for the women, let's learn the habit of being healthy even before we conceive. And the day you find that I conceived, go and have a check. Yeah.
Okay. All right. Thank you so much for shedding light on matters diabetes and hypertension. It was really, really a pleasure to get to host you on the show. Thank you for coming.
Karibu sana, and you are welcome to Metropolitan. We are going to be having Metropolitan Hospital. We'll be having a medical camp whereby you can come and we check your blood sugar, we check your blood pressure on the 28th of February. And you know, when you come in to the healthcare providers, we don't just see the two, we will see beyond, because we have been trained that we'll tell you that maybe you also need to do this. Yeah.
All right, on the 28th at Metropolitan
February.
Hospital.
Yes.
All right, there you have it. And this is where we get to end this conversation. We always have such conversations every Tuesday. We talk matters health, and it is always very, very informative. So you can tell another person who's never tuned in at this point or at this time on KBC that they are missing quite a lot. We get to learn a lot. So yeah, we do this again tomorrow, same time and place. My name is Vivian Dagwa. Do enjoy the rest of your viewing. Bye-bye.